This topic is borderline personality disorder. This is a cluster B personality disorder. This diagnosis is for clients who fall on the border of two different diagnoses, neuroses and psychoses. These clients can also be diagnosed with bipolar disease, anxiety, depression, and other mood disorders. When you think of this disorder, I want you to think of four main parts. Number one, intense impulsivity. These clients don't have very good impulse control, and they do not think of the consequences of their behaviors. Number two, emotional dysregulation. These clients have frequent mood swings. Number three, unstable relationships. These clients' attitudes towards others fluctuate intensely. And number four, poor self-image. They lack a clear sense of self and also suffer from self-image distortion. These symptoms cause significant distress for the client, which means it affects their day-to-day living. This behavior usually starts in early adulthood or puberty, when the client's personality is developing. Let's take a closer look at the clinical manifestations. Poor self-image. These clients lack a clear self-identity. They cannot develop a healthy self-image. They have fear of emptiness. This is coupled with an intense fear of abandonment, which leads to unstable relationships and potentially splitting. Let's talk about splitting for a second. Splitting is a coping mechanism and a primary defense mechanism. These clients can only view others as wonderful or horrible, good or bad. They can't understand that in one person, both good and bad aspects can coexist. This can be demonstrated by a client in an inpatient unit overvaluing a relationship with a particular nurse. That is the good nurse. They may say, "This is the only nurse who can save me, who can cure me." But then the client's view of that nurse could completely change if they think maybe that nurse didn't appropriately acknowledge them in the hallway. Now that nurse is the bad nurse. They can't do any good for them. These clients will have mood instability. Their moods can last minutes, hours, or days, and they generally have very, very broad mood swings, generally speaking in response to a stressor. Their emotional responses are normally out of proportion to the actual situation. These clients have inappropriate anger. They cannot control their anger, and it often results in physical fighting. They can have transient paranoia or distrust. They have intense feelings of distrust and believe that others are out to get them. An example could be that they believe their significant other is cheating on them or poisoning them, or they could feel like all of their friends hate them. They may also experience dissociation. This links back to that self-image distortion. Impulsivity. They have poor impulse control, and this can lead to self-damaging behaviors like substance use, overspending, binge eating, gambling. And along with this poor impulse control, again, they don't see the consequences of their behaviors. These clients may have recurrent suicidal ideations and also partake in self-harm behaviors. They could cut themselves or burn themselves. Sometimes these behaviors are self-soothing or numbing for the client. The medical management for this client will include psychotherapy. Dialectical behavioral therapy is a specific type of cognitive behavioral therapy. This is specifically for the client's urges for self-harm and suicidal behaviors. This is based on the idea that the biggest issue for this client is their emotional dysregulation. The clients will work one-on-one and also learn group skills. Overall, this type of therapy helps the client's interpersonal skills. It also helps the client with managing distress and their self-harm and suicidal behaviors. It focuses on coping skills to help with their emotional dysregulation. The client may also have cognitive behavioral therapy. This type of therapy helps change their perception of themselves and others. It may improve their mood, also decreasing their anxiety and helping with interpersonal relationships. The client may be prescribed pharmacotherapy. Some of these medications can help with the symptoms of borderline personality disorder. The client may be prescribed atypical antipsychotics to decrease anger and self-destructive impulses. The client may also be prescribed mood stabilizers to help with that emotional dysregulation and those mood swings. The client may also be prescribed selective serotonin reuptake inhibitors. This can improve their mood and decrease their self-harm behaviors. Nursing interventions for this client include the nurse establishing a therapeutic relationship. This may be difficult for these clients because they struggle with those interpersonal relationships. Clients may demonstrate manipulative and splitting behaviors to try to gain control and power. To address this, limit setting is very important for these clients. The nurse needs to set firm, clear limits, using a non-threatening, firm tone. The client may try bargaining. I'm only going to go to group therapy if I get another smoke break. The nurse can respond with already referring to what has been established. Earlier, you agreed to go to one group each day. We're not going to bargain on this further. There needs to be consistency across all staff members with the limits and the consequences. The nurse will calmly reinforce appropriate boundaries and reinforce the rules and expectations. You'll want to explain consequences for unacceptable behavior. The consequences should be geared towards something that the client values, like phone restrictions or completely removing all phone's privileges or reducing a smoke break. Again, this is an area where it is important that all staff members are consistent. If the client would engage in unacceptable behavior, the nurse can remind the client of the rules, the expectations, the goals, and the consequences. We'll want to monitor these clients for self-harm behaviors. We want to look for any sort of evidence of burning or cutting. We will want to encourage the client to seek out a staff member if they start to feel any of these self-harm urges. If the client has been successful with a self-harm behavior, the nurse will remain neutral in cleaning and dressing the wound. The nurse does not want to give any sort of approval or disapproval to the client. The nurse will encourage the client, after the wounds are dressed properly, to write down what they were feeling prior to the behaviors and then the consequences of their behaviors. This independent exercise helps the client think about their actions and behaviors and also process the consequences to their behaviors on their own.